Super, you are on the air now.
Okay, good afternoon, good morning, depending on where you are. We are so glad to have two exceptional individuals who are trained in computer science from University of Illinois at Urbana-Champaign and now professors. But I'm going to introduce them. But today, it's a topic that AMSET has organized, the webinar, Autism, Therapy, Role of Community and Technology. Autism is a disease that many of us have faced with among our family members, among community members, among our friends, particularly in the children. 1 in 44 children in the US are affected by autism. And autism is just not one disease, it's a broad variety of forms that it comes with. And the parents only know how difficult it is. So today we have two professors coming and we'll be talking about autism. They both graduated. One is Shamim Ahmed, who is one of our University of Illinois Urbana-Champaign graduates, PhD from computer science. And now he's a professor at the Western Washington University. This is a state where I got my master's degree. And so Professor Shamim Ahmed is an associate professor there in the computer science department. And he has been very prolific in wide range of topics. In fact, I looked at his website and it makes me very proud because one of our alumni is doing so well in the professional domain. With Shamim Ahmed, we also have Professor Moushumi Sharmin. She's more known to us as Neela because both of them got their PhDs from University of Illinois Urbana-Champaign in computer science. And I will call her Neela because that's the way I'm more known to her. They're both very dear to our Champaign, Illinois community, UIUC community. So Neela also got her PhD from computer science department here at University of Illinois, and she's been working quite actively on autism. So I'm really looking forward to their talk. I'm here to learn and maybe also facilitate the Q&A after the talk. So with that, Shamim and Neela, the floor is for yours.
Thank you.
Assalamu alaikum.
Assalamu alaikum.
And today, the way we want to describe, we will start with a very brief introduction about what autism is, because working with autism for the past 7 years, we know that many people, they have a very vague idea of what autism is and what are the characteristics to look forward to when you are trying to understand it. Then we will go over the interventions, the supports that we can provide. Then we will briefly touch on society and role of mosque and our community. And finally, we will conclude with 2 of the research currently we're doing that heavily focuses on autism and supporting. So if you see the roadmap, you will see that we will start with autism, then go into intervention, then talk about family, community, and mosques, their roles. And finally, we'll conclude with the technology that we are developing here at Western. So as Tahir Bhai mentioned, like autism, so I am starting with a contradiction. So autism, as we know, it's not a disease. It's a different way of being. And I will explain what we mean by that. So when we say something is a disease, we assume that there is a cure. But autism is a condition, a neurological developmental disability. And the way it manifests is the wearing, plainly saying the wearing in our neurons, the brain, how it works. For autistic individuals, it works differently. And as this is a condition in the brain and how the brain is wired, at present, there is no known cure. And a group of researchers are also looking into that. There are lots of genetic research going on to understand what is the primary factor contributing to autism, and there is no well-known validated cure or well-known cause that we know. As of now, we will say that autism is a developmental disability that enables people to work differently. Another thing I want to mention, and that is something that we want everyone to acknowledge, that is, it's a lifelong condition. It may be hard to know because you might hear from others that someone was autistic and now they're not autistic. They became typical or regular or normal. So autistic people, they're born in that way and the condition does not go away. So what happens is these people who are autistic, they learn through therapy and other type of intervention, they learn how to live or how to be more like neurotypical individuals. And another thing that's important to know that when we say someone is autistic, the diagnosis can come in any time, any form, any part of anyone's life. There are babies who got diagnosed with autism, but there are adults and young adults. So the phases of detection is not specific, and it's difficult to detect very, very early because the symptoms manifest in communication, social communication. That's hard to detect in babies. So when you look at these pictures, we are showing some 3 kids who are in spectrum, and there is a wide variety. When we say autism, we are not saying that it is one type of thing. And Tahir Bhai also mentioned that this is a wide variety of characteristics. One autistic person can be widely different from another autistic person. So people can be verbal, non-verbal, or selectively non-verbal. So what we mean by that is someone who can talk and talk a lot. Then there are others who does not talk at all, but they communicate in different ways. And then there are people, group of autistics who physically have no limitation, nothing preventing them from speaking, but they chose not to do that because it's really difficult for them. And we are talking about them as they're selectively nonverbal. But it doesn't matter what type of autism someone has. They might need a lot of support, but with that support, they can live full independent lives. So that's another important thing that we should remember. And some people, especially people who does not know much about autism, they will associate autism with learning disability or a lower IQ, which is also not true. Many autistic are categorized or recognized as gifted, and IQ well above 130, which is really high. So I will briefly touch on a few autistic traits. So the first one is special interest. So what we mean by special interest is that autistic individual, many of them will have 1 or 2 things that they're very, very fixated on. So kids, they can have preference for a specific color and they might want to wear only clothes that are of that color, or they might only want to play with a specific type of toys like cars and trucks and whatnot. Or they might be really, really interested in a specific topic like math or sciences. So that is one of the traits, that they will have a very focused interest on something. And again, as this is a spectrum, this also varies. So someone can be really focused on one thing for their whole life. Others can be interested in one thing for 1 week, then move on to another topic for a different week. And as we work with this, we want to tell you that there is nothing wrong in having a very keen interest, because there is evidence that if we can give proper support, then as they're genuinely interested in a topic, they can do really well surrounding those topics. So if someone is really into photography, they can become great photographers. If someone is really good into math, they can become professors in mathematics. So the special interest can be nurtured or used for their benefit. Then stimming is another thing, and stimming is a way of saying the same thing or doing the same thing over and over again. And this can come in many forms. So some people will notice that kids, they are flapping their hands, or they are jumping around, or they are just rocking back and forth. So that's a form of steaming. And in this steaming, why they do that? Autistics, when they don't feel comfortable, it helps them to regulate their emotion. So the sense of overwhelmed or being anxious, they try to calm their mind and body by doing steaming. So in general, therapists are these days are saying that if they're not harming anyone, or if they're not harming themselves, then don't prevent steaming. Let them do that, because this is their way of self-regulation. The third autistic trait I will talk about is communication difference. And this is the biggest thing that we notice when we talk about autistics. So one is echolalia, and echolalia is when they're repeating things. So they can be like watching a TV show or a cartoon, and later they're exactly saying the same thing without the proper context. So that is echolalia. And the second thing is scripting. So they might be saying the same thing, disrespecting or disregarding what you are asking. So sometimes many autistic kids, their parents will ask them, how are you? And they can say their name as an answer, because they know that, okay, that was my name. And when I mentioned my name, they became happy, but they disregard the context. And these type of things can be improved by engaging in therapy, communication and speech therapy. The final one is socializing differences. And this is something, again, that we hear a lot, that autistics are not social. The problem is autistics are actually social beings. They are just like us. They want to be social. But the problem stems from this idea that they are not really good at guessing what other people are feeling, and they're not very good at expressing how they are feeling. So neurotypicals, like people who are not autistics, neurotypicals we are typically good as human beings when we look at someone else's face. We hear their voices. We can guess what they're feeling. But autistics are not good at that. And as they're not good at that, they don't get the social cues that we present when we are in a social situation. And that makes it really, really difficult for them to become engaged with others, to make friends, to behave appropriately in social settings. And this is the biggest challenge for parents when they have an autistic kid, like how to take their kid and make them social, engage in social activities with them, engage in family activities with them. So eye contact is another thing that is really important, and many therapists and doctors, actually doctors use eye contact at very early stage, like when babies are 2 and 2.5, to see if they're having eye contact. And this is used as one of the diagnostic tools. But as right now we know that from autistic adults who are verbal, they express that why they don't look into our eyes when they communicate. Many autistic people have sensory processing disability, and they are overwhelmed by all the sensory information that they receive from us. So if you think about it, like when we talk, we are not talking with just plain language, right? We are varying our voices, tone, we are using our eyes, we are using our faces, we're making different type of gesture. And all this information are a lot to take in for someone who has sensory processing issue. So it helps autistics if they don't look into our face and look somewhere else, then they can focus on the voice and the actual words that are spoken. So nowadays, like very, very recently, therapists are saying that don't force them to look into your eyes, because then they will be able to actually hear and listen to what you're saying. And the final thing is nonverbal communication. Like many autistics, as I mentioned before, they can be nonverbal, or they might be selectively nonverbal. That doesn't mean that they don't communicate. They don't speak, but they communicate. They communicate with their body. They communicate with their sound that they make. And many times, as we are neurotypicals, we don't get it. but they're actually trying to communicate with us. So as we are neurotypicals, we actually need to take the first step in understanding how they are communicating with us. So I will just summarize what I discussed so far. So first of all, if you are taking one thing away from this session, know that autism is not an illness or a disease, but this is a developmental disability. There's a lot of misinformation regarding autism, but as you are hearing from us, and I think in one of our slides, the sources are mentioned, you will see that science is saying that it's not a disease. Autistics communicate, interact, behave, and learn, and they do that slightly in different ways than how we learn these things. And again, as this is not a disease, there is no medical cure, but there are lots of ways to improve the condition. And if someone is autistic, we know that they will be autistic their whole life, but that doesn't mean that they will not be successful.
Thank you, Moushumi. So now, as Moushumi gives some brief idea about what is autism, I would like to talk about what kind of services, because this is a development disability and they need help. So what kind of services we need. And the reason actually we're mentioning here, because we found that there are lots of misinformation about the services or treatment. So we want to make sure that what are the scientifically proven, especially from the CDC, Center for Disease Control and Prevention, what do they recommend? So I would like to briefly give those points. There are some other mentioned. So our suggestion, well, actually suggestion to all who are dealing with autistic kids, maybe they focus on what the science says and what the CDC or all of this organization, like authentic organization, they suggested. So here is what, based on what CDC mentioned, that there are 7 kind of interventions or services are available. The behavioral, developmental, educational, social, relational, pharmacological, psychological, and complementary and alternative. I will try to go very briefly. I have lots of information, but due to the sake of time, I would like to go to this. But this is the main idea right now, which are proven by the science, that these are what we can do for helping our autistic kids. So the first one, which is very popular, it's called behavioral approach. And the most significant approach is called applied behavior analysis. And perhaps most of the autistic kids, when they are small, they actually have this approach, ABA, although it was not designed for autism, but it is perhaps the de facto service or treatment right now is used to the autistic kids. So how it works, it is very straightforward, very simple technique. It encourages desired behaviors and discourages undesired behaviors to improve a variety of skills. And usually progress is tracked and measured to see how the kids are doing. So this is ABA. This is perhaps the most notable in behavioral approach. The second one is developmental approach means that they are trying to focus on improving specific development skills. Like development skills mean some autistic might have some issue with the language skills or physical skills or a broad range of interconnected development abilities, what Moushumi mentioned in her slides. So what in development approach says that okay, they normally try to combine ABA or behavioral approach with these skills. Usually there are few of them. The most two major one is, the first one is speech and language therapy, because some, as Moushumi mentioned earlier, some autistic people communicate verbally and some use different non-verbal thing. Now, the speech and language therapists, they are trying to help the autistic kids so that they can learn how we can communicate with the other people. If they are verbal, using verbally. If they are not verbal, within the other processes like signs, and including the electronic communication device. And second one is occupational therapy. Again, there are many. These are the two main in development approaches. So it teaches skills that help the person live as independently as possible. For instance, the dressing and eating and bathing and how to relate with other people. Some autistic kids have some challenges with that, occupational therapists try to help them in those regard. So there are two things in this occupational therapy that actually are also used: sensory integration therapy, because some autistics have some sensory issues, and physical therapy to improve their physical skills like motor skill, fine motor skill, or gross motor skills. So these are actually part of the development approaches, which is the second one. So that means we can say developmental approaches are speech and language therapy and occupational therapy. The third one, which is another popular one, is educational approaches, mainly in given in classroom setting. Like when autistic kids go to the schools and learn with other kids, so then what can you do? So there is one popular, it's called TEACH approach, treatment and education of autistic and related communication handicapped children. So this was developed by a university research group, and this is very popular, especially in the classroom settings. So the basic idea is that the autistic people thrive on consistency and visual learning. Many of them are visual learner. So that means that it helps, this approach helps the teachers to adjust the classroom, because they are learning, the autistic kids are learning with the neurotypical kids. So they need to adjust the classroom structure to improve the academic and other outcomes. And it really helps the autistic kids, especially in the classroom settings. Like, for instance, the daily routine can be written or drawn and placed in clear sight so that they know what they can expect. Boundaries can be set around learning stations and so on. This is our educational approach. The next one is social relational approach. So it focuses on improving social skills and building emotional bonds, because as Moshimi said, sometimes they have a struggle, like how neurotypical like us, we normally use social skill, they need to learn those. So the social relational approaches following that. So I will go very quickly. So this one concept is called floor time, and official name is developmental individual differences relationship-based model. So the basic idea is that, so here the parents also can do this kind of therapy. So they normally sit with the kids in the floor, because the floor, normally the autistic kids play a lot in the floor. So they actually join in their own environment. And so they try to build the relationship first, and they try to understand what they like and what they don't like. And based on that, they, like the parents or the therapists or both, they try to help them to build the social relational skills. So this is the informal, it is called floor time, and another is called social studies, to give them different kinds of things. Okay, what might happen in real world and how should they do? For instance, when autistic kids go to the playground, what might happen and how you can help them to understand what are the norms. So this is another very prominent approach in social relational approaches. Now, the pharmacological approaches actually, many, especially when we talk in Bangladesh, we saw that many parents, they are trying to use different kinds of medication. CDC explicitly mentioned that no medications are here yet for the core symptoms of autism. There are some medications. These are actually mainly treating the co-occurring symptoms. Many autistic have some co-occurring symptoms, like they might have the ADHD, like high energy levels. They might not focus correctly, or they might have self-harming behavior, and like head banging or hand biting. So pharmacological episodes, they normally provide different kinds of medication, the doctors, to help those symptoms, not the autistic traits or motion we mentioned. So that means medication to manage co-occurring psychological conditions like anxiety and depression and others. So here, CDC explicitly mentioned that it is important to work with an experienced doctor, and individuals, families, and doctors must work together to monitor progress and reactions to be sure that negative side effects of the medication do not outweigh the benefits. So this is the very key point we need to look at. We are trying to help them. So now, whatever the medicine they are providing, they are suggesting that all those like who are working together, doctor, families, and individuals, they need to say that the negative impact should not be higher than what they're expecting. Now, the last, I think the psychological approach is the second to last. So many of them are having anxiety, depression, and it is very common for others too. And it is very common for autistic individuals. So the CBT is a cognitive behavioral theory, which actually try to say that they need all of the individuals need to focus on the connection between emotion, thoughts, and behaviors, which are actually impacting each other. So CBT is a very well-known therapy in this psychological approach. So where at that time, a therapist and the individual work together to identify goals and then change how the person thinks about a situation to change how they react to the situation. That means they're trying to help them how to think, how to change behavior and emotions so that they can mentally be strong. So this is another approach suggested by CDC as well. And the last one is the complementary and alternative approaches. So there are some approaches which actually does not fit in any of these categories mentioned in the last slides. So often used to supplement more traditional approaches. And for instance, might be special diets and herbal supplements and chiropractic care, etc. But one of the things we always, all of the parents and others should remember that we need to talk to their doctor before starting a complementary and alternative approach. We just need to look at the internet and say, okay, I saw it works, because there are many claims which are not true. They're trying that they will cure autism. Please don't look at those. Please talk to your doctor, an expert who knows this and who can help your kids. So in summary, these are the main 7 approaches suggested by CDC and all of these organizations who work with autism. And these are some examples of those approaches. So that actually ends our second part. So maybe we need to go to the other part real quick because we don't have much time. So we would like to focus on what we can do as a family, communities, and also mosque to help them. Our main, based on our research of the last several years, I think that the role, we are trying to put the role of families and communities and mosques in different way. The role of families is, the first thing is the awareness. It is not like, don't need to be panic. It is regular, and it is 2020, it was 1 in 54, tired by says is 1 in 44, and it is who are diagnosed. And there are many kids, especially girls, and who are people of color. So they are not diagnosed. That means the number might be much higher. So it is not uncommon. So first of all, the awareness is very important. And second thing is that families need, like the autistic kids need families support and understanding. They want to live like a real, regular, neurotypical person. But if families are become panicked and they always think that, okay, this is a curse or this is not good, so they need our more support and understanding. So based on our research, we can say that the family should focus on how they can support and how they can understand, and acceptance. So this is our part of our society. We should accept autism is just another neurodiversity. Patience is very important. We know, because we deal with special emotion, work with the autistic parents of the autistic kids. They're extremely stressed, and we know they are going through lots of challenges. And because as a Muslim, we believe we trust in Allah. So patience is very, very important. But over time, it becomes much, much better. And in terms of community and mosque, so empathy, because if we don't show the empathy towards the autistic kids, so then as a Muslims, as a human being, so this is I think we should do to all of the human, especially to the autistic, the empathy, like what kind of challenges they have. And definitely they need to be aware of those, that, okay, what is autism and what kind of support they need. They also need some support and understanding from the community and mosque, and maybe from the mosque. So because I don't know whether it is, I did not see personally in the different Juma khutbah, but maybe if our Islamic scholars or the Imam, if they give khutbah on autism, that, okay, how our Musalli and our Muslim brothers and sisters can help the autistic kids, that might be really, really useful if our religious leaders focus on that. And the 2 things I would like to mention, I think we would like to do that, actually suggest that inclusivity in mosque and Sunday or weekend school, so that many times the parents, they don't feel comfortable to bring their kids to the mosque, to the weekend school, Sunday school, or maybe Saturday school, or the Juma prayer. So, but we should, as a community, as a mosque, we should include them. We should embrace them as much as we can. This is way, because they are also, if they're born in the Muslim family, they are also Muslim. They need to know the Quran, the Hadith. If we don't include them, how they will learn? and they can learn. They can learn. So this is like misconception that they don't learn, they don't understand. They understand, they learn. We need our support, and we need our inclusivity in mosque and the Sunday school as well. So I think this we can do as a community and as a in the mosque as well. So maybe briefly, Moushumi will go to some of the technologies, because there are lots of technologies have, and we are focusing some cutting edge computer technology for autism. Moushumi will focus on very briefly what are those we are doing, try to do here.
So in our lab, like Shamim, myself, and our collaborators are students, and we also have collaborators in Bangladesh, in Europe, and even in India and Singapore. What we are trying to do is we are trying to look at autism holistically, not looking at one aspect of autism. So we are right now, the different projects we are involved in actively. One is mental health, because we saw that the rate of depression and anxiety is really high in individuals with autism, even kids with autism. So we are trying to look at wearable technology, lightweight wearable technology like Fitbit or Apple Watch, and how we can use them to detect automatically when they're getting stressed and provide some intervention. Then another project that we are working on for the past 3 years is parents with autism and how we can improve their lifestyle. It is proven that the parents who have autistic kids, their stress level is, most of them have PTSD. So the stress level is comparable to the veterans' stress level. So it's extremely difficult, and there is little support provided by family or community or the society. So we need to, we are trying to come up with technology that can help them in their challenges. Then I mentioned before that many autistic kids are nonverbal, and we are trying to design technology that will make it easier for them to communicate what they're feeling, what they need. So maybe not with spoken words, but with devices, with gestures, with pictures, with music, because many of them are good at those things. Then we also have 3 different projects geared towards young adults, college-going students, because many of our students are also autistic, and they are super brilliant, bright students. So we want to focus on how they can be independent and become part of successful, have successful independent life. So one of the project is based on VR technology that looks at how they can be successful in traditional interviews. Then another one is mentorship, where we are talking about support, getting support from others, and then a college student and their lifestyle in general.
Yeah, so just want to let you know that the autism, as Moushumi said, we should focus on holistic approach, and we need lots of people from different sides. So we are computer scientists in training, we know the technology, and we have collaborators who are expert in the mental health and others. So we are trying to say that, okay, there are lots of things we can do from different point of view. So we are trying our best, because we are using that cutting edge technology, and one of our major goals is to use the technology which is easily available, so it should be like Fitbit or smartwatch people are normally using, and everyone uses smartphone nowadays. So we are trying to understand using this regular technology, not like very fancy technology, regular technology, where we can collect all of this physiological data, like what they're doing in their daily life, try to understand what is their life, what kind of things they are doing, and what kind of challenges they have in their day-to-day lives. And we're trying to get their sleep pattern and their physiological data, because they have some sensory issues when they become stressed and so on. So we're trying to understand, and so that they can be successful in their college education. And as Moushumi said, we are using another technology like the virtual reality-based technology, and it becomes very, very cheaper nowadays. Many people are using that. So we are trying to use this kind of technology to help them improve their interview skill. Because one of the challenges we saw, especially autistic adults, many of them are capable to do a great job, but they cannot pass the barrier of the interview. Now we are trying to help them, okay, now how can they improve their interview skill? So we are looking at from different point of view. One is that we are focusing on like smart chart, like we are collecting physiological data using the smart chart. And we are looking at their like facial recognition, facial expression and eye contact to see what they're doing and how they can improve. And we're giving them live feedback and also giving them like the post-interview feedback so that they see what is happening and they can see from different point of view when they talk louder, when their physiological data has been changed, when they become stressed, what they're looking at, and so on, so that we can help them, okay, what is happening and how they can improve over time. So I think we will stop here because it's almost 40 minutes. So, but we have other technologies, but I think it is better to stop here now. If now I would like to open the floor for questions from Tahir Bhai or from our audience, if there's any, we'd be more than happy to answer.
Okay, very well. Thank you, Shamim, and thank you, Neela. This is fantastic. I have learned so much from this very short talk, and I appreciate that you have condensed everything, your many years of work in such a short time frame, almost in 35 minutes. Of course, the audience can ask questions. I think Sohail, you'll be sending the question to the chat. There is so much to talk. Maybe I can start. One thing about the autistic children is typically how long is the lifespan? Is it comparable to the normal individuals or is it shorter?
It's not shorter, like there is no reason for it to be shorter. And as Shamim mentioned, like many autistic kids have co-occurring comorbidity, co-occurring conditions. So that might impact, but other than that, they don't have anything physiologically that should reduce their lifespan. Because I did not go into detail, but the condition is neurological. So the wearing, the way the signals pass through their brain, that's different. So when how the signals are coming to move our muscles, that's a little bit different than neurotypicals, but there is no physical deformity. Yeah. So that's why it should not impact their lifespan. Yeah, so I may include one thing, Tahir, here. So there might be some data that usually their lifespan might be lower than the regular one. The reason is not like autism. The reason is that because, after when they become adult, they don't have any support. They don't get the support from the society, from the government, and they just live a very isolated life. So sometimes they are like, when you are not doing anything, so your health will deteriorate. Do you know what I'm saying? So it is not due to the autism. It is like what happening due to autism, like this kind of issue, they cannot find a job, no partner. So those actually might impact, but not autism itself. Yeah, depression and the rate of suicide is much higher.
Yes, you mentioned about depression, anxiety. These are serious mental health problems, and people come with them even without autism. People have them even without autism. So in fact, that leads to the second question is, if you think about the normal population, part of the normal population who suffer from depression, anxiety, within the autistic population, then is it higher?
It's much higher.
Much higher. Okay.
And we can get data in this regard. So in the autistic community, only 11% of them ever become involved in a long-term relationship. And there is nothing wrong with their physicality or anything else, right? But the stigma associated with autism is many people will not marry their sons or daughters to someone who is autistic. So the rate of suicidal attempt among autistic adults who are 25 to 30, at least 80% of them, we know that at least attempt suicide, and for 60% of them attempt multiple times to commit suicide. So that's much, much higher than the neurotypical population.
I see. Of course, that begs the next question is that the typical drugs that are used for depression, anxiety, do they work in a similar way as the autistic individuals or no? I mean, there are now reasonably good drugs. It's not curative, but at least it provides some help for those who are depressed or who are anxious. Is it a similar efficacy or less?
So I will not answer that with a yes and no, Bhaiya, because one of the study that Shamim just briefly mentioned, we looked at college life challenges of autistic college students. And for that, what we did, we collected millions of data points from a group of autistic college students and neurotypical college students.
Mm-hmm.
And sometimes we really, really looked into stress and anxiety. And when the reasons are similar, then similar type of drug will work, right? But there are many times the reasons are not similar. So now one of the major depression, causes for depression or stress in autistics is social isolation, the inability to form a bond with anyone, basically. And that is not that common when we think about other neurotypical population. And the drugs that are used, many times they create anxiety, like long-term anxiety, and uncertainty is another huge factor. So autistics in general don't do well with uncertainty. They will avoid, like our students, we saw that the navigation pattern was tremendously different. College students, they are coming to class, they're going back home. And they're just there. They're not getting engaged in anything else. And time to time, you ask them, like, why are you doing that? And their answers were, like, we don't know, if we go outside, we might get overwhelmed. We might have a meltdown. So they don't want to, like, show their vulnerability to others. So the causes, when the causes are so different, then it will be difficult to treat them with the same medication. We believe that the best thing for autistics to like help them with their depression would be the support that can come from family, society in general, and from any organization. That should be the main deciding factor.
Yeah. So I want to add that by one thing is that what Moshimi said, I totally agree and support. So those medicine like that should work for particular thing, but the root cause, if we don't look at the root cause, like if someone is diabetic, so the medicine will work, but the root cause is maybe the lifestyle is not good. So if we really want to help, we should say, okay, maybe reduce your sugar intake, do the exercise and so on. But their root cause is like they cannot make, they have some social anxiety and others. If we as a community, if we start embracing them, that which will really help them. Now they know how to make friends, how they can have family their own, so I think definitely medicine work, but we should focus on the other important factor which would really help them.
There is a question from Sohail. There are rehab facilities for autistic kids. Many parents who cannot manage their autistic kids send to these facilities. Question is, do they use the techniques you mentioned? Also, how does such treatment impact the patient-children relationship or parent-children relationship? Yeah.
You want to answer?
You already start, then I will continue.
Okay. So I will say that we have a son, and as parents, I can say that nobody can love your son or daughter more than you. So parents are the best possible sources for love and care and support. But we understand that sometimes it's not possible for parents, and they send their kids to facilities. And the therapies, some of the facilities that are good, they try to use them, but the therapies are only as good as the therapists who are providing them. So ABA, the most highly renowned, widely used technique worldwide for autism, that's the best one. We work with many autistic adults who are autistic, who can advocate for themselves. Majority of them, 90% of them, hate it with passion. When we talk to their parents, they like it because they see improvement. But the autistic adults who went through that therapy, they don't like it because they're saying that you are treating me like you are not teaching me, you are training me. So you're treating me as a pet. You are telling me to change my behavior. So I look, I talk, I walk like someone else who I'm not. So if you can find a center facility that will value these kids as individuals and not someone who is defective, definitely that will help. These type of centers are few, not a lot, and schools are the same. Many schools will treat these kids with great care and try to find, if you know someone, try to find a school that does that. Ranking of schools comes secondary. So we know, like, there are horror stories of how a school in New Jersey applied physical restraint, electric shock therapy, because they could not manage the behavior, but they were not focusing on how that kid was so scared and anxious. So for these, like, the best thing that a parent can do is tell them, express that you are fine. Everyone has difficulty, everyone has challenge, and we are here to help. And if they can establish that, rehab facility, the people, therapists who are engaged in those, if they can provide that, then it will work. But not all centers are using these advanced techniques, these trainings.
And maybe I would like to include the second part, that was saying, how does such treatment impact the parent-child relationship? I would say, like, it has in both negative and positive, because for instance, like when ABA, what Moshimi said, is applied, you see that therapists and parents, they love it, because they say, okay, now my child look like a regular kid, like quote unquote normal kid. So, but it actually goes through their nerve, like it becomes very, very painful for them. But since they're kid, they cannot they cannot advocate for themselves. But when they become adult, so they think that, okay, my parent, although they love me, but they did not support me at that time. So what Moshima is trying to say, that because no one can love your kid more than you. So you should try your best to understand this and listen to your kid. Listen to your kid, like what they're going through. Mm-hmm. So even nonverbal, they can communicate via normal thing, but listen. What are they are trying to say, and they see what is happening. So hopefully, if we listen to our kids and try to understand their emotions, so definitely, because they understand their love, so they will definitely impact. But if we just follow blindly just to make it, then it might impact negatively to the parent-child relationship.
Mm-hmm. Mm-hmm. So this makes it, of course, interactions much more difficult, because there is no one size fits all.
Yeah.
Unlike, let's say, a cardiac disease where if the valve is not working, you replace with the valve. But because it has so many shades of autism, there is no one thing that is good for this kid and will be applied to the other one. So it has to be totally individualized, which makes it extremely complicated. But that raises the more scientific question, which is diagnosis. At what stage is the diagnosis best? And also, is the diagnosis based on some physical measurements, or is it, you alluded to some, or is it mental, or is it both? Because it's sort of an outcome, a developmental outcome, which is rooted in maybe somewhere in the brain that we don't know yet. Maybe it will be known at some point in our scientific journey, but at the moment, so how is the diagnosis done? Because based on the diagnosis, and not just saying the word, oh, your kid is autistic, but that's not so useful. But is there a sort of a more fine-grained diagnosis, so that a therapist can tune or cater that particular kid's need based on that fine-grained analysis? Is it done now, or is it not done yet?
So in America, it's done in many different levels. So the pediatricians, they always have these questionnaire that parents need to fill out, and with any data, if the data is flawed, the diagnosis will be flawed. And they ask questions related to communication, then just communication, but then also social communication, and then developmental milestones, like if they're how many words they know, whether they're talking, whether they're doing repetitive behavior. And these are done starting from 18-month onwards. And many times it's very easy for doctors to ignore those things, because if parents are not raising this question, like they will not look into that. They will just look at like eye contact, because that's easy to check in a pediatrician's office. But in USA, the major diagnosis comes when kids start their public school. So in public school, either parents can request that you test my kid and see if they will, all public schools in the US have a speech therapist, occupational therapist, social communication therapist. And if the parents ask, they will send a team and they will observe the kid, and they have very specific set of activities and questionnaire designed targetedly for kids who are 5 and 6. And they can analyze those and come back to you saying that, yeah, we diagnosed these and this, and you need to go through this therapy. Schools here, public schools provide therapy, but as you all know, in US, education is not the best sector, right? It depends on where you are, where you live, which school district. So the type of facility you will get from school will vary so much depending on where you live. And then parents can always, like, even when kids are 3, like one of the early signs is not talking a lot, like, or repeating the same thing. So these are signs. It does not mean that someone has autism, but these are early signs. So taking them to a psychiatrist would be best, because they would observe. The way psychiatric diagnosis for autism right now works is the first session is with parents, not with the kid at all. So they will talk to 1 or 2 hours with the parents. There is pages and pages of questionnaire, like 10 or 14 pages of a book type questionnaire that parents need to answer. Then the second session will be with the kid, and a psychiatrist will observe the kid for 1 or 2 hours. And even after that, they might suggest some EKG and ECG, 1 or 2 days in hospital stay. They will see the brain movement and everything. So depending on different, like, as autism can be as, I don't want to say high functioning, because that's a term that people don't, like people who need less support. So it can be undiagnosed because they look, talk, behave exactly like other people. They're so good at masking. And then there are other kids or other adults who need so much support that you can tell right away that they are not even talking to you. They're just always looking at the floor or somewhere else. They're like constantly moving their hands. They're constantly like saying the things without context. So you will be able to diagnose that easily, but the spectrum is so varied. So there are guidelines, standard procedures, standardization, but with people of color, the diagnosis is less, because they don't, many times they think that this will get fixed with time. So we don't push that hard. And with people who are not affluent, a huge percentage are not diagnosed. So the more diagnosed groups are white people who are affluent, and girls are significantly less diagnosed because they're so good at masking this behavior.
Yeah, and just maybe one thing I want to add here, that like when parents see some difference, because especially it might be difficult when they're the first child, because they don't have any example that, okay, well, but if they see that they are having some, like, they're fixating with one small object, maybe toys, they don't they don't actually play with the other kids very easily. So then so just talk to your pediatrician, like, and also like the maybe psychiatrist. So definitely they have what Moshimi said, this is actually we observed. They have very rigorous process. They can give you the But if you have some issues, don't wait. Just
Mhm.
go and talk to them.
Therapy works best if it starts early,
Early,
like
yeah.
the best possible outcome we'll get, any parent can get if the therapy is starting at age 3.
Okay,
onwards.
so the earlier the diagnosis, the better.
Yeah, it's always better because the other thing, for instance, if they sometimes they cannot talk. Maybe their muscle is not working. If they know that like speech and language therapists, they help them. They maybe they have hard time to eating. If they find this issue, because those are not like autistic, those are like some co-occurring things. So if you see that means there's a chance they might have this. So it is better to start this one early.
So from your studies, do you see that if the intervention is done very, very early, let's say at the age of 3 or so, if you compare this early interventional group versus those who are let gone, in later stage of life, in adulthood, is there a significant cure in the sense that they behave more normally, or is it something that they can reverse? Can the neurons be trained enough so that the deficiencies that some neurons that might have contributed is taken care of by some other neurons? I'm thinking in terms of when people have a stroke and they do therapy also, all of these occupational therapy, physical therapy, and so on. And the idea is those neurons which collapsed or which didn't survive during the stroke is compensated by the other neurons. And over training, they begin to gain the same function that they have lost in the first place. Is that an outcome of the therapy over a long time?
So there is evidence that the earliest you can start therapy, and if that therapy is done properly, it will have significantly different impact. Like it will be their behavior, their activities will be significantly improved than the counterpart who did not receive therapy. And I think I don't know for sure whether it changes the neurons or trains other neurons to do that. But what I can tell from our research is that autistic kids or individuals, they're very attached to routines, and they get habituated. Change or transition is difficult for them. So when you become used to in certain type of behavior, you will not change. So kids who don't speak, non-verbal kids, if they learn how to communicate without speaking, because speaking is difficult for them. They cannot find the right words in the right moment. They cannot, in their head, they're screaming that I want to say, but the connection signal that is coming to the muscles are not there. So with therapy, it can improve. But as you let many days, years pass by, it's less likely to work. The impact will be less effective if you wait. So therapy, occupational therapy, speech therapy, everything will have much better effect if they start early, because they are not then like our limbs too, right? If we are not using a part of our body, they get lazy, they don't work. It's the same thing.
I see. And so this is where you see the use of technology, the advanced technology, sensing technology, and something that transfers maybe the brain signal to something as an output, right? Whether it's virtual reality or so where do you see the future of the technology in helping?
So one of the things, Bhaiya, we are doing very passionately for the last 5 years is automatically detecting when they're getting stressed, like when they're crossing that limit where they will have a full-blown meltdown. Because we don't want them to isolate just because of this fear that I will have a meltdown or breakdown. So right now we actually published 2 papers where we prove that we can, without any input from the autistic individual, with 80% accuracy, we can detect when they're approaching that window. So as we can detect that, the next step is sending intervention in their mobile phone, telling them that do this 1 minute breathing exercise, take 5 minutes of walk or other type of like intervention that will help them to reverse that situation. So
that's very, very encouraging. That's very encouraging. So what signal do you use to quantify the threshold?
We are using their heart rate variation, HRV. We are also using their activity level. We are also looking at, so we are right now the factors, we are looking at the social scenario, the brightness of light, the loudness of sound, because all those create, all those have an impact on stress level. So we use individuals' baseline stress, and we compare, this model compares like with all those factors, whether it is significantly, like whether it is slowly rising to that point, and we can detect that window. So right now it's a 10-minute window. That's 80% accurate. If we want to go get closer, like a 5-minute window, then accuracy drops to 77%.
Okay, but still very good. Still very, very good.
So
that's what we can do right now.
And another technology where I can, regarding the non-verbal autistic, so one of the challenges we, when we talk to the autistic parents, because, non-verbal, it is hard to communicate with them. They, because the research we did, most of them with like verbal, they told us that, okay, what is happening? That means whatever we are doing, we can verify. One of the challenges and technology we are trying to do, and MIT is also doing in this regard, like how do we understand the emotion of the non-verbal autistic kids? Like what are they thinking? And when we talk to the parents of non-verbal autistic kids, many of the time they guess, but many of the time they don't understand what their kids are trying to say. They really want to help, but they don't understand. So the technology we are focusing on, one of the research is that how we can use different kinds of data, like their sound, like they are making some sound, not talk, but sound, and their physiological data, what is happening inside their body, and and
respiration also.
And also like some kind of devices so that they can say, okay, what they're feeling, maybe hungry or they're angry, or so we're trying to combine and talk to the parents to pinpoint, okay, in this moment, what is happening in their mind. So that by looking at the app, the parents know, now I understand my kid is really happy or sad, or this is the reason that is happening, because they cannot talk. We state that, okay, and we mentioned earlier that they communicate, sometimes, head banging one of them, because something is happening to them. They want to talk, but they cannot talk. So there's a frustration. They actually start head banging. Now we will understand, okay, by looking at this, using this technology, what is happening inside their mind. So it is also very, very in a preliminary stage all over the world, but using like future technology, definitely it is going there. So then now they will communicate with us like a regular, typical verbal communicator.
So we are actually like collecting data from many people so that we can create models, like learn the signs and symptoms. And the ground truth for that study will come from parents and caregivers and therapists. Like we will show them, like this is the sign, this is the sign, and if they understand, they can like tell us that this is what they mean. So that will be that is the current project that we are investigating in Bangladesh, and we have collaborated in Bangladesh, Singapore, and here in US, where we are collecting this data to build that model first. Like if we can identify different types of emotional representation, it's not verbal, but
right. So some kind of images of moods.
Like what does it mean?
Right. So if the kid can relate with a facial image which represents anger, or a facial image of happiness, like a smile, maybe the kid can relate to that. This is how I'm feeling now.
Or it's more like what is happening inside. So our data will automatically show that. Because now there are some technology they can express it. Okay, now they can press the button that, okay, now we are saying that can we detect it automatically? They don't have to.
Okay.
It will automatically come to parents. And okay, now I know what is happening inside.
I see.
Because they're making some sound, just sound.
Mm-hmm.
They're making some movement. So what does it mean? So are
Mm-hmm.
they feeling, because so this is more like proactive rather than like they will approach, but rather than it will automatically come to the parent. Okay, now they will say, okay, now I understand what is happening.
So these are all sensor based because the 6 main primary emotions like happiness, sadness, anger, frustration. We are working on that. A group of MIT researchers are working on that. We are close to identify those emotions automatically by looking at heart rate and our perspiration and gestures and body movement, like whole body movement.
And definitely the sound
that they make. So collectively, all this data will help us to distinguish what it means to be angry, what it means to be frustrated. So they don't have to tell us. The device, after the sensors will collect the data, process, run a model, computational model in the back and process that, and then tell that, yeah, this kid is now frustrated.
I see.
But this is early, like we
early,
started,
very early stage.
yeah.
Right.
6 months back, MIT is working on it for
maybe 2 years.
2 years. Yeah, this is still early.
So this is like something watching them, some image processing, which will tell us their body movements, and some built-in device measuring their heart rate and perspiration.
So in Pratika 4, like things like that, like there are devices like that actually they're so sophisticated right now. In Pratika E4 actually collects all this data.
Correct. Yeah, there are devices now which are in the labs. You probably have heard about Professor John Rogers. Now at Northwestern, used to be at Illinois. So there are devices that does just like a small, the Band-Aids, just like a small Band-Aid, you put it here, and it gives you 28 measurements, including the ECG, breathing rates, or audio, vocal signals, the sound that you mentioned, sleep patterns. So it records the data for 12 hours in your iPhone, as well as transmits the data. And that could be used to identify. The main objective here was to quantify the depression or anxiety among mentally ill patients.
Yeah, it's very similar. Our approach is very similar, but we are looking at autistics and nonverbal.
Right. I mean, this is basically the holy grail, right? Because for all other disabilities or diseases, there are, you talk about blood pressure, there are numbers, there is imaging, MRI imaging, and so on. Then you can say, oh, there's a tumor in the brain, or there's a tumor in pancreas. But both for autism as well as mental diseases, there is no quantitative measure until now. It's all based on a set of questionnaires. And as you know, many patients, I'm talking about more mentally ill patients, they can also pick and choose the answers, get to a desired outcome. So a kid who is in the therapy unit wants to go home, they can choose the answer. So the doctor says, oh, this kid is fine now. But actually, they just fool the doctor. Similarly, the one who comes from homeless families, they want to stay in the therapy unit. They also could say that I'm stressed and depressed, and so there is no quantitative measure that doesn't rely on the individual that gives out.
The thing here is that sometimes autistic individuals, sometimes we train them to understand by what does it mean, like this expression means angry, this expression means happy, but that means they understand other people's face. Sometimes they don't understand their own, because when they become angry, so what should we? They know, okay, I know Tahir Bhai is happy because I see. But when I am happy, So sometimes they have like hard time to say that, okay, what is
Mm.
the emotion? You know what I'm saying?
Mhm.
You know, so that means that detection itself, because they don't detect themselves.
Mhm.
You know, so that means it is a very challenging task. We can say, you know, so because sometimes you say the example, they say they intentionally do that, but
Mhm.
if they don't know what is that,
Mhm.
then even they want to do that, they cannot say it.
They
It's
cannot
much more challenging than that.
Right, right, right. So of course, we have these ethical dialogues all the time that if an external agent, a computer or a device or a sensor with all the parameters give out a, a score of autism or score of mental state, that means we are quote unquote making a judgment call on the individual, right? So there's a fine line between these two.
Yeah.
So that's the difficulty with anything that is mental issues involved. Maybe the last question, we are almost coming to an end, or maybe we have crossed 1 hour already. Maybe one last question is, maybe this is known or not known. Do you know anything that people have found out so far on the origin of autism? Of course, you mentioned genetic, you mentioned about, it's a developmental problem. But how much do we know? Do people know about autism in animals so that people can study them? In mice, is there a mice model for autism that people
Yeah,
study?
because I don't think there is even like a human model of autism, but and there is, as far we know, there is no known origin or reason. Like there's lots of speculation.
Yeah,
Mhm.
still by a speculation level.
But we know, like now looking at the data and behavior, autism is all about behavior and how people behave. So now scientists are saying that Aristotle was autistic.
Maybe some famous people.
Yeah, then Newton was autistic, but now they're saying it. At that time, they did not say that. And the signs and symptoms, many times autistic signs and symptoms and the neurological condition, they overlap so much with people who we call gifted or genius. Like their brain function is very, very, like at least high functioning autistic brain behavior and the structure and the size of different parts of the brain actually mimic those of gifted people. So they have so people who we used to call, or other people used to call, like recluse, or they're like very socially not isolated people. So they were like, right now we can say that maybe they were autistic, because they're the major thing is they are really good at cognitive abilities, education and science and math, really good at identifying patterns. They're not so good because brain has, the size is kind of equal, right? So if your cognitive ability is taking up lots of space, then the emotional part of the brain that controls emotion will be a little bit smaller if the entire size is the same. So, and that is the thing that people are trying to look at, like which people were emotionally behave differently, had a low emotional understanding. But lots of, like, there are lots of myths and really bad, really, I don't want to say bad science, but people had published papers and then those are disproved. Like at some point worldwide, mothers were blamed for autism, because they used to say that if mothers are not giving love and mothers are like very, very like they're not showing affection, then the kids will turn out to be autistic. We know right now that that data was falsified and that was not
obviously not scientific, right?
But it was published in like a really good journal, and that book was the only book available in many countries in libraries. But then many years later, it was found that the data was completely falsified data.
Another one, like the vaccination.
That's also.
There is a research paper on that vaccine might cause the autism, but later this paper was retracted, So there might be some misinformation from scientific community as well, but it is getting better. We are learning, but to answer your question, where it is still
Not known yet. Yeah.
not near yet. It is still
Yeah.
exploring the exploration stage.
Right. Very complex. Right.
Very complex. Very complex.
Anything that relates to brain is still an unknown territory, right?
Yeah.
Yeah. And see, in fact, there is I don't remember. I think there's a mathematical theorem which says that an entity cannot fully understand itself. The theorem is much more sophisticated than the way I'm telling. So it's like, the human species, Homo sapiens, are the only ones that have organized language and abstraction. No other species have it. They have it in a very elementary way, like whales can talk over long distances, but it doesn't store the abstract information that its previous generations have achieved.
Yeah.
So that's the cognition. In fact, one of the ayah of Surah Rahman is that I have given you language, bayan in Arabic, right?
Yeah.
I thought it was an extremely enlightening ayah, because that speech through which we store information, we store the information of the previous generations. We talk about Newton because we have codified what Newton thought in terms of his contributions, in terms of his theories and laws, right? And the next generation takes over from it and continues. So this entity that we are cannot understand ourselves based on the theorem. So if we have issues with mental health or autism, that's where our most important feature of us that isolated us from the other individual, other animal species, right? And this is the part that we cannot understand. I think your answer that we don't understand, we don't know the origins of autism, or just like we don't understand very deeply the origin of depression, is basically saying that, no matter how hard we try, there'll be always this barrier, because that's where we are unique compared to others. Well, thank you so much for your time, and I think this has been. Sorry, I have gone way too far. I think, was it 1 hour? Way too far. But anyways, I hope if someone watches these videos later, will benefit from it, both in terms of being more compassionate, accepting that we may have issues with our other human fellow beings, and we should learn to live with it and respect. Okay, with that, we end here. And